Have you ever wondered why your legs are getting weaker even though you eat well and maintain light daily exercise? Why just climbing a few stairs makes your knees shake? Or why a single leg cramp at night is enough to disrupt your sleep for hours? Is this merely a sign of aging, or is there something silently happening inside your body that is making your legs less steady than before? The truth is, many people over the age of 50 take good care of their bodies, but still overlook one important factor: a lack of essential vitamins that help maintain muscle strength, protect joints, and support the motor nerves. And when this deficiency lasts for too long, the consequences go beyond just tired knees or weak legs. The risks include falling, losing balance, and eventually losing independence in daily life. A study published in the Journal of Clinical Endocrinology and Metabolism in the United States showed that older adults with sufficient vitamin D levels maintain better balance, walk more confidently, and significantly reduce the risk of bone fractures from falls. But it is not just vitamin D. There are two other vitamins that are just as essential for keeping your legs strong, your joints flexible, and your reflexes sharp. If you're looking for a way to keep your legs strong, mobile, and less painful each day, then this video is made for you. Together, we'll explore 3 important vitamins that restore leg strength from within. These vitamins are scientifically proven and easy to incorporate into your daily routine. You won't need to make major lifestyle changes. Just understanding the right way to use them can help your legs feel a noticeable difference. At the end of the video, we'll also share one key factor that many people overlook, which can greatly reduce the effectiveness of vitamin supplementation. So please watch the entire video. Sometimes one small piece of knowledge at the right time can save you from a long and painful journey of weakness and discomfort. 1. Vitamin D, the silent source of energy for steady legs. You may have heard of vitamin D as the vitamin that strengthens bones, but the truth is, its role is far more significant than that. Especially for middle-aged and elderly people, vitamin D acts like a silent fuel source that keeps your legs strong, your balance stable, and helps prevent falls as you walk. As we age, our skin no longer synthesizes vitamin D as efficiently as before. Our bodies also get less sunlight due to spending more time indoors. As a result, vitamin D levels in the blood begin to drop, often without any clear symptoms. But over time, the effects become visible: weaker muscles, less flexible knees, unsteady walking, and a higher risk of falling. A study published in the Journal of Clinical Endocrinology and Metabolism showed that older adults with sufficient vitamin D levels had stronger muscles, better balance, and a 22% lower risk of falling than those who were deficient. In other words, if you often feel your legs are tired or struggle to sit or stand, that may be your body warning you of a vitamin D deficiency. Biologically, vitamin D helps the body absorb calcium more effectively. But more than that, it directly affects muscle function. Vitamin D activates protein synthesis in muscle fibers and supports the transmission of signals from the brain to the motor muscles, especially the fast-twitch muscle fibers. These are the muscles responsible for helping you maintain balance when you trip, miss a step, or slip slightly. Without enough vitamin D, these reflexes slow down, making it easier for you to lose balance and fall, even in small situations. Additionally, vitamin D reduces inflammation in muscle tissue, eases pain, and helps relieve numbness or unexplained muscle cramps. Many people who supplement with the correct amount of vitamin D report noticeable improvements within just a few weeks. Better sleep due to fewer nighttime cramps, easier movements when sitting or standing, and less leg fatigue when walking. So, how do you ensure you get enough vitamin D each day? The simplest way is sunlight. Just 15 to 30 minutes of sun exposure daily in the early morning or late afternoon is often enough. Let the sun reach your arms and legs directly without using sunscreen during that time. However, for those who cannot go outside often, relying on food and supplements becomes essential. Foods rich in vitamin D include salmon, mackerel, egg yolks, mushrooms, milk, and fortified dairy products. But in reality, the amount of vitamin D in food is often not enough for older adults. Therefore, many health experts recommend that people over 50 take vitamin D supplements, typically at a dose of 800 to 1,000 international units per day. However, if you are seriously deficient, your doctor may prescribe a higher dose for a short period, along with regular blood tests to monitor your levels. If you are taking medication for osteoporosis, diuretics, or blood pressure, consult your doctor before taking high doses of vitamin D. This is because vitamin D can affect calcium metabolism and interact with certain drugs. Vitamin D is not just a vitamin. It is a silent companion that keeps your legs steady, your reflexes sharp, and helps reduce the pain and risks of falling or nighttime cramps. If you have ever felt unsteady going down the stairs or shaky when standing up from a chair, don't blame aging too quickly. Think about vitamin D first. 2. Vitamin B12, the connection between the brain and your legs. When your legs feel heavy, numb, or like needles are pricking your calves, you might think it's due to poor circulation or sleeping in the wrong position. But sometimes the root cause doesn't lie in the legs at all. It lies in something most people overlook: a vitamin B12 deficiency. Vitamin B12 is one of the most important nutrients for maintaining movement, coordination, and reflexes in the legs. Unlike other vitamins that focus on bones or muscles, B12 works primarily in one area that rarely gets attention: the motor nervous system. This system sends signals from the brain to every muscle fiber, helping you perform movements that seem simple, like taking a step, maintaining balance, or getting out of bed. When B12 is lacking, nerve fibers gradually become damaged due to a loss of their protective coating called myelin. This causes the signals from the brain to become delayed or disrupted, leading to weak legs, loss of sensation, slower movements, or even falls. This is why people with vitamin B12 deficiency often describe the feeling as if their legs are no longer their own, even though their general health seems fine. According to a study published in the American Journal of Clinical Nutrition, about 15 to 20% of people over age 60 in developed countries have a mild to severe deficiency in vitamin B12, yet most go undiagnosed. This is because the symptoms appear slowly, increase over time, and are often mistaken for natural aging. As we age, the ability to absorb vitamin B12 from food declines. The body requires stomach acid to release B12 from protein in food and a special protein called intrinsic factor to carry it into the bloodstream. But with age, stomach acid production decreases significantly. The use of acid-reducing medications, treatments for acid reflux, or diabetes also worsens B12 absorption. So even if you eat plenty of meat, eggs, and dairy, your body might still lack B12 if your digestive system isn't functioning well. People who follow a long-term vegetarian diet, have had stomach surgery, or are taking acid-reducing drugs are at higher risk. Common symptoms of vitamin B12 deficiency include numbness in hands and feet, especially in the morning, heavy legs, difficulty walking, shaky or weak legs after standing for a while, frequent loss of balance, no feeling in the soles of the feet, chronic fatigue despite adequate sleep. Some people even describe the sensation as walking on air or not feeling the ground beneath their feet. If not treated in time, prolonged B12 deficiency can cause permanent nerve damage, directly affecting your ability to walk and perform daily activities. The good news is, vitamin B12 deficiency can be significantly improved within weeks when supplemented properly. When B12 is restored at the correct dosage, the nervous system gradually recovers, reflexes improve, and the legs regain strength and flexibility. How to supplement B12 effectively? Vitamin B12 is found in foods like red meat, liver, seafood, eggs, dairy, and dairy products. Among these, beef liver and clams are the richest sources. However, as mentioned, older adults often cannot absorb enough from food alone. So, oral supplements or B12 injections prescribed by a doctor are safer and more effective. The typical oral dose for older adults is 500 to 1,000 micrograms per day. For those with severe deficiency or digestive disorders, doctors may recommend B12 injections every few weeks or months. Vitamin B12 is one of the safest vitamins to take because the body eliminates excess through urine without harmful buildup. However, a blood test is still important to determine your current B12 level and guide your doctor in choosing the best dosage and form of supplementation. If your legs often feel frozen or out of control, You may be lacking vitamin B12 without knowing it. Don't wait until a fall happens to start paying attention. Because your legs don't just need strength, they also need accurate signals from your brain. And vitamin B12 is the silent wire that transmits those signals for every steady step. 3. Vitamin K, the guide for calcium and the shield for your knees. When it comes to strong bones, most people immediately think of calcium and vitamin D. But there is another nutrient that, if lacking, can make all your efforts with calcium and sunlight less effective. That nutrient is vitamin K, a commonly overlooked yet crucial commander that ensures calcium goes exactly where your body needs it. There are two main types of vitamin K, K1, found in leafy green vegetables, and K2, found in fermented foods and animal-based sources. Both are important, but each plays a different role. Among them, vitamin K2 is considered the key that delivers calcium directly into the bones, rather than allowing it to deposit in blood vessels, joints, or soft tissues, places where it can cause more harm than good. In older adults, especially postmenopausal women, there is a high risk of arterial calcification, joint degeneration, and rapidly progressing osteoporosis. One contributing factor is that calcium supplements are not being directed to the right address. When vitamin K is deficient, the body cannot produce enough of a protein called osteocalcin. This protein binds calcium to the bone structure, helping increase bone density, prevent fractures, and allow joints to move smoothly. Without vitamin K, calcium tends to go astray and accumulate in blood vessel walls or joints. This leads to stiff joints, pain during movement, and heavy legs. That's why many people who take calcium regularly still suffer from knee pain, weak legs, and frequent falls. A study conducted by Tufts University in the United States tracked more than 600 elderly individuals over 3 years. It found that those with higher blood levels of vitamin K had a 65% lower risk of hip fractures compared to those with deficiencies. They also experienced less joint pain and slower cartilage degeneration, especially in women over 60. Vitamin K not only strengthens bones, it also acts as a gatekeeper for the joints. When vitamin K is adequately supplemented, inflammation around the joints, knee pain, stiffness after sitting for long periods, or morning stiffness all show noticeable improvement. Common symptoms of vitamin K deficiency include knee pain when squatting or climbing stairs, joint stiffness in the morning, cracking or popping sounds in joints while moving, legs that feel less flexible than before. In particular, vitamin K also helps regulate calcium within muscle cells, making the muscles more flexible and responsive. A body with sufficient vitamin K is less likely to experience muscle cramps, maintains better balance, and has a lower risk of nighttime cramping or falling. So, where can you get vitamin K? Vitamin K1 is abundant in dark green leafy vegetables such as spinach, kale, Swiss chard, broccoli, cabbage, and cilantro. Just one bowl of vegetable soup or a plate of boiled greens each day can make a meaningful contribution. Vitamin K2 is commonly found in fermented foods such as natto, a traditional Japanese fermented soybean dish, aged cheeses, free-range eggs, egg yolks, and animal liver. This form of vitamin K is more stable in the body and more effective in supporting bone and joint health. For those who cannot consume many vegetables or who have digestive issues, vitamin K can also be taken through supplements. However, if you are taking blood-thinning medications like warfarin or high-dose aspirin, you should consult your doctor before supplementing with vitamin K to avoid interfering with blood clotting processes. One more important point is that vitamin K works best when combined with vitamin D and calcium. This trio functions in harmony. D helps absorb calcium, K directs calcium to the bones, and together they prevent calcium from building up where it shouldn't. If you only take one or two and leave out vitamin K, the benefits may not be complete. If you've ever wondered why your knees still hurt or feel unstable on stairs, even when you're getting enough calcium, then vitamin K may be the missing piece of the puzzle. We have now explored 3 essential vitamins that directly affect the strength and stability of your legs every day. Vitamin D lays the foundation for strong bones and quick muscle reflexes. Vitamin B12 protects the motor nervous system and maintains control over each step you take. Vitamin K coordinates the proper use of calcium and eases joint discomfort, keeping your movements light and flexible. No medication can substitute the consistent and proper supplementation of these vital vitamins, and no step can truly be steady if your legs are not nourished from within. If you have ever worried about falling, suffered leg pain while walking, or felt your body slowing down day by day, then these 3 vitamins offer a gentle yet effective solution to help you regain strength, stability, and confidence in each step. Remember, you don't have to do everything at once. Start with the smallest changes. 1 timely vitamin tablet, 1 plate of leafy greens at dinner, 1 early morning moment in the sun. These small daily actions, when repeated regularly, will make a big difference in your health and quality of life.